It's, my challenge to myself is, how do I get into preventing this flu or being a part of the war on disease? And Cecil Drinker heard me out, and he said, Steele, and referred to my performance as a student, you've done well, you got nice personality, good voice, you have all the things for creating new opportunities in public health. Why don't you fly under one flag, meaning a veterinary degree, instead of staying and getting a medical degree? And naturally I look back and say, that's the best advice that I had ever received in moving up the scale. And after Harvard, after getting a fellowship, I wanted to think in broader terms. I felt policy making. How do I build a program where I have the veterinarian providing leadership? And that became my big challenge. And then as the war ended, there came requests to evaluate problems in the neighboring states of Haiti and the Dominican Republic. And there I got into really basic work. And I could say some of my best ideas came from seeing the complete absence of veterinary medical care. And that's a wonderful conversation that occurs in September 1945, when Mountin said, after a few exchanges, he said, all right, Steele, tell me, what are you veterinarians going to do for the country now that the war is over? And that gave me opportunity to immediately start talking about what I later put into a formula of public health, animal health, economic health. And he said, that sounds good. Write me a white paper so I got something to refer to in congressional hearings. And that was the beginning of my MPH, Veterinary Public Health, being a name. And
could you tell me, Jim, because I think it's both so relevant but such a human, after that white paper that you had written for Joe Mountin, if you would relate, as you had to me previously, when he authorized you to start a veterinary public health, what he told you. And
what happened was, Mountin says, you're going to be a part of this new center we're creating down in Atlanta, one that had been called Malaria Control in War Areas, MCWA. And well, that to me was going out to the sticks. I wanted to be in Washington, where policy was going to come to be. Well, it turned out that it was the right thing to do, but I had to play it hard and make sure that the thing was a part of the big picture. And September, and Mountin gets my stuff in October. In November, he's sending me down to CDC to talk to Mark Hollis and to see how I'm going to fit in there. And I always worked as a beneficiary of people in Washington knew what I was doing at CDC. This point I want to make here is I had given Mountin this white paper. He had sent me down to Atlanta and this for a week or whatever the time was, and back to Washington. And when I come back to Washington, Mountin said, I'm going to assign you to NIH. Well, I immediately interpreted that this was my proving ground. Could I hold my own with all these high-level MDs, PhDs? And that I did. And Charlie Williams, who's above Mountin, says, I want you to come to a meeting with me, with the Army. They're bringing home 10 million soldiers with all kinds of pets, all kinds of living creatures. Williams, before this, had asked me what we should talk about. And I said, well, we're dealing with all kinds of animals. The predominant one we should be concerned with is rabies. And then he says, I brought along our chief veterinary officer. Well, that's the first time I ever hear that term, CBA, CBO. And I'm just feeling good. I've done everything right. And what's going to happen next? But anyway, something does happen. A memo circulates that a Veterinary Public Health division, or division, is being created. And I will be the head of it as the chief veterinary officer. And then following that, whatever the dates were, Atwater calls me and says, I've been hearing about you. And that was my first contact with APHA.
So they were ranked as sanitarians. Were you trying to put the veterinarians in on equal footing with the physicians?
Yes.
And
That book there, One Man, One Medicine, One Health.
Well, that's why I read that.
Yeah.
And I thought that was very clever.
Yeah.
I mean, it was appropriate, but clever to build up the parity.
Yeah.
See, what I wondered was that after you establish the veterinarian, public health veterinarian program, that
The VPH.
yes, that I was thinking CDC, everything kept growing so big that you were now part of this bigger movement.
Yeah,
you know.
I was part of it. And then I had to change my strategy. That I could not argue that I wanted to be identified as just a small division. I saw the good opportunity and a valuable contribution to the overall mission of CDC, that veterinarians could fit in with the MDs and do their work very effectively. And that became not so much my mission, except it was my vision, but the people that succeeded me immediately accepted that, and integration of the veterinarians in according to their ability, be they in the laboratory, be they in infectious diseases. Fred Murphy was the first to head up the division of infectious diseases, where it always had been an MD, and John Hughes was his deputy. And this it turned out to be very, very good all the way. That it was demonstrating that the veterinary medical officer could complement the medical officer and live up to that title of one medicine, one health, one world.
So you mentioned a cousin got you interested in veterinary.
Yeah, Bill Thorpe.
What his name was?
William Taylor Steele Thorpe. William, and his mother's name was Taylor, and his father's name was Steele, but both his mother and father died childbirth. Taylor, his mother, died of hemorrhage. The father became so depressed, alcoholic, so on, that the story goes he just drank himself into a stupor and was found frozen to death on the street in northern Michigan. I wasn't there, so I can't verify, except to say that it was so. Then their baby that survived was adopted by Dr. Thorpe, who was a dentist, who was married to Aletha Steele, my father's sister. I ran into my cousin on the sidewalk outside his office building, Pathology, and we got to talking, and I said, I want to do something, service to the community, service to the government service. I said, something where I have a salary, I'm insured, that I am doing something for the public good. And he said, well, why don't you think of veterinary medicine? And I said, I hadn't really given it any thought. And he said, well, you could be a practitioner in any of those suburbs around Chicago, take care of some cattle, take care of some pets, do city work as a food inspector, rabies control, meat inspection, milk inspection. And the more he talked, the more I thought, well, then the most important thing at the end is saying, and there's no unemployment among veterinarians.
Yeah.
So, damn it all, I said yes. And I said, now, what do I have to do to get this thing going? Maybe all that came overnight, 2 nights or 3 nights later. And he said, you gotta go talk to the Gilder, to D. Gilder. And I had heard that he was quite crusty. Bite your head off if you didn't respond. And I went in to see him, told him who I was, that I was a product of the recession, that maybe I didn't say it, that depression, but what I had to say indicated immediately that I was thinking of FDR and the New Deal. I was praising it and saying that opportunity existed under the new administration. And he said something to the effect, well, why do you want to be a veterinarian? I just kind of blurted out and I said, I understand I can make a good living. And he looked startled. And he said, what would you do if you heard about home economics? And I said, I would be interested in finding out more about it. And my frankness and candidness hit him just right. And he quizzed me further, and everything I spoke of was, I am at the bottom, I want to start going up. I want to get education, so I'm of value to society, to mankind, to the government. I want to do something to raise the level of society. And this is the kind of stuff that Franklin Roosevelt was talking about. So it struck him as interest. He said, well, go see what you can do. I said, what do I have to do? And he said, that's your first task. Get out and do it. He was very kind. And out of that grew a good relation, because later on he was the one that got me the fellowship to Harvard, when I said I wanted to do public health.